like to invite Paolo Mirabelli. Good afternoon, Paolo.
Come stai?
Good afternoon. How are you? I'm fine. I have a broken knee, but I'm at home and so I can do lots of things. Okay, we have been talking to each other quite a lot, and we know that a lot of makers and manufacturers are doing a lot of things. We will have a platform available soon for interaction. Can you tell us more about what you are doing in order to combat such virus and provide solutions for this crisis? Well, everything has been hectic and fast. I was working in my pajamas and some projects just started in a very natural way, and we wanted to come up with solutions, even partial ones. And so we met on Facebook, but also through local groups, and we try, first of all, to be careful and to think a lot about what we're doing. So we just don't want to print whatever. We want to be very careful and working with lots of makers and players. And we do that not for profit, and this is important. I just would like to make a comment. You said printing. I mean, printing for you, of course, you're talking about a 3D printing, but can you tell us more in terms of 3D printing? Well, we started in 2012, but now I'm still in love with 3D printing, which is the best way to manufacture products. We are in Cosenza, in the south of Italy. We are working on an intubation box, which is quite simple. So we should have come up with this idea much earlier. So basically, I met a doctor, and we had to create a clear box made of polycarbonate for the intubation of patients, ensuring safety, in particular safety of workers and healthcare workers. So this is the project, and this is what I invented at home. So this is the intubation box, and this is helpful for patients, of course. And we also have another project. The project is aimed at modifying masks. Of course, we have been collaborating with international groups, and basically in Milan, they do design the product, and I do print the product myself, and then the product is tested. So the idea is to create personal protective equipment for the healthcare workers. And I think we have been working on that for 14 days continuously. So we design, we print, and we test the products. Of course, we want to ensure the safety standards, the safety of physicians and patients, of course. Of course, we are in an emergency. And, for example, I discovered that at the university of my city, they do have a lab where they test products and where they can test products. Of course, we know that these products are for compassionate use, but before providing these products to the workers, we want at least to test them, which is something which is still missing. Do you have something to show us? I can show you the intubation box. it is the clear box that you see over there. Okay, we can see it. I getting closer. It's such a simple idea that you really think I should have done that much before. It's like a barrier. Basically, we are also adapting and changing it. So we want to make it even more smart. And I want to disclose what we are doing, but for example, we would like it to become a sort of a globe box, and we are also working on sensors. And I think that tomorrow, the first box will reach the hospital, and the head of the hospital will test it and see whether it is possible to test it with the patient. Okay, now we can see you perfectly. Okay. A very last question for you. As Maurizio was saying, there is now a strong network of cooperation. Can you confirm it internationally among all makers, but also all the people interested in innovation? So in your city, but also in other parts of the world. Well, actually, when there is a need which rises, then you see a lot of calls, and a lot of people want to participate. Of course, this cooperation is international, so worldwide. The most important thing to us is to find research documents to be inspired of in order to take best practices. And it is very important to meet researchers or to get into contact with experts and professionals. For example, in Milan, are dealing with these things for such a long time. So everything is faster, everything is open source, and we have created, for example, a specific dedicated account with no reference to companies or universities. So the model is made available to everybody. Every person can download and use it or modify it, and everything is so fast. It's happening so fast that sometimes I don't even have time to wear clean clothes or to get rest, because you want your knowledge and know-how to be shared and to be made available to other people. So we just don't want to print whatever, but we want to be based on evidence, because we try to satisfy needs, but at the same time complying with the safety standards. Well, congratulations for what you are doing. It would be nice to see such a cooperation throughout the year, not just in a time of emergency. Thank you so much for accepting our invitation. Thank you.